Welcome to CaribWorld Report, your trusted source for clear and reliable coverage of major developments in Jamaica, across the Caribbean, and around the world. Confirmed leptospirosis cases after Hurricane Melissa, Ministry of Health issues warning.
The disease, because the clinical signs are similar to many other diseases, common diseases, even though we're in this dengue outbreak, some of the clinical signs are similar to that of even dengue.
Jamaica health authorities are sounding the alarm following the confirmation of 11 leptospirosis cases and 2 tetanus cases by the Ministry of Health and Wellness. The cases have emerged in parishes that were hardest hit by Hurricane Melissa, including St. James, Hanover, St. Elizabeth, and St. Anne. Dr. Karen Webster-Carr, the national epidemiologist, explained that the widespread flooding caused by the hurricane has created ideal conditions for infectious diseases to spread. Leptospirosis, which is transmitted through water contaminated with animal urine, poses a high risk for those who come into contact with floodwaters, especially if they have cuts or broken skin. The Chief Medical Officer, Dr. Jacqueline Bissessor-McKenzie, said that the current conditions raise a significant risk of infection, urging people in affected communities to seek medical care early if they experience symptoms.
Let us talk about leptospirosis. In the aftermath of Hurricane Melissa, there would be large pools of water on the ground. These waters may become contaminated with urine from rats or from other animals that are infected with leptospirosis. Once we are wading in those waters, walking in those waters, or getting those waters that are contaminated with leptospirosis on our hands into our faces and our mucous membranes, or we're ingesting any food that may have been contaminated with those waters, then we can become infected with leptospirosis.
According to Pan American Health Organization Situation Report 7, part of their response includes prioritizing water, sanitation, and hygiene efforts to mitigate the risk of disease transmission. The organization has issued a donor alert calling for urgent support to address the health needs arising from the hurricane, especially in remote areas where infrastructure has been damaged. The ministry is urging affected residents to avoid contact with standing water, ensure their drinking water is treated, boiled, or disinfected, report symptoms such as fever, jaundice, muscle pain, or unexplained wounds to health centers immediately. This health alert underscores the complex challenges Jamaica now faces in the aftermath of Hurricane Melissa, as the island not only recovers from physical damage but also prepares to contain disease risk. In addition to leptospirosis, 2 adult cases of tetanus have also been confirmed, one in Westmoreland and another in St. Elizabeth. And that concludes this edition of CaribWorld Report. We appreciate you staying with us for the latest updates from Jamaica, the region, and the international community. If you found this report informative, please like, share, and subscribe to the channel. Feel free to join the discussion in the comments and share your views on today's story. Thanks for watching.